They may not be able, now try. Pardon? Try now.
Hello, everyone. Just making sure we're getting ready to go, and I think everybody who has signed on was entered directly into the room and didn't have to wait in the waiting room. Does that mean I'm muted? What is that?
No, that's, I muted the Al, you're good.
Oh, okay. I didn't know what that meant. Well, welcome again. My name is Susan Lee, and we're glad to have you for our webinar for COVID-19 guidance and updates for nursing homes and adult care homes. Just making sure everybody is aware, today's presentation is being recorded. I want to know that for sure.
It is.
Okay. And the recording from today's webinar will be on the website once everything is reviewed and finalized. And I'd like to introduce our presenters today. We have Annette Graham on Zoom, not in person today. And she is the Executive Director of the Central Plains Area Agency on Aging. Hello, Annette. And then we have in our meeting room today, Kaylee Harvey. She's our Epidemiology Program Manager here at the Health Department. And then we have online, Cody Charvette. He's our KCEM Operations Officer. He's a KCEM. I think that's a certification of some kind. And he's with Sedgwick County Emergency Management. We have a full agenda today, which was sent out to our partners. As you can see, we have, we're going to have updates on the COVID statistics for our area, the state, and of course, the United States. And then some updates on CMS testing and reporting for nursing homes, executive order testing and documenting requirements that came out in December. And then we are going to have an update on the NP and saliva testing and information about the COVID-19 vaccine for long-term care and adult care homes. And then we'll have some update again on the PPE and N95 decontamination. And just an introduction on the update on the emergency public health order, along with Sedgwick County, the phase 2 and the metrics. And then we'll go into some presentation on the compassionate care and other visitations, and follow up with our Q&A with our presenters and our participants. Anyone having any comments, please submit your questions, comments into the chat box, and we'll follow up with them as we see them. And we do have a date picked for our next meeting, which is going to be February 16th, same time, 11 to noon, via Zoom. And then to start our presentation, we'll have Kaylee. Do you want the controls, or?
Sure.
Okay, I'm going to hand the controls over to Kaylee.
The mouse sign.
You just want the mouse?
Yeah.
Okay. There you go. Thank you.
Good morning, everyone. I'm going to give you our standard kind of COVID-19 update to start. As of basically yesterday and a little bit today, we've got 22,620,333 cases of COVID in the United States. We have 247,502 cases in Kansas. We've had 35,392 cases in Sedgwick County, and we have had 309 deaths in Sedgwick County. And I do want to just kind of point out on the deaths, if you see those large jumps in deaths, that's because of the way the data is being reported to us, not because we're seeing large, chunks of deaths happening. So just kind of be aware when you see those numbers. And we've also had 70 total adult care home clusters and we currently have 729 active cases in all of the clusters for long-term care that we have right now. When we get an update on testing, we have shifted a little bit, but presently we still can do, presently twice weekly testing still must continue for staff who have received the COVID-19 vaccination. So at this time, the guidance we've received from KDHE is that even if all of your facility is vaccinated, staff and residents, they are still having you follow the CMS guidance of the twice weekly testing. That will likely change in the future, but at this time, you still need to do both of, still do that twice weekly testing, even if they have been vaccinated. CMS is requiring against skilled nursing facilities to test staff and residents, and again, are those that are CMS funded, and that's the executive order from December 9th does require adult care homes to test staff and residents, and that's those state licensed facilities. And if you want more information, you can click on the link available on the slide. For the CMS final rule on nursing facility testing, that interim final rule, again, is established to provide information related to COVID-19 and the public health emergency for long-term care facility testing requirements and a revised COVID-19 focused survey tool, and you can access those documents at that link provided. And finally, another interim and final rule that establishes when testing of staff and residents need to be done with COVID-19 symptoms or signs, when testing of staff and residents must be done in response to an outbreak, and when routine testing of staff must be done based on county positivity rate, and that is available at the link on the slide provided as well. And then we have Governor Kelly's executive order, which requires testing of staff and residents, again with COVID-19 symptoms or signs, again, testing of staff and residents in response to an outbreak, and also routine testing of staff based on the county positivity rate, and we've also provided the link to that executive order as well. So currently, KDHE has our positivity rate for Sedgwick County sitting at 14.6%, and that does put us still in the red, and those metrics, again, can be obtained at the link on the slide. And this is looking at the current 14-day rolling period of December 27th to January 9th of 2021. And so the CDC guidance for SARS-CoV point-of-care testing was updated on December 30th of 2020. And so we provided the link to that updated guidance. And it does contain regulatory requirements for point-of-care testing and also who can do point-of-care testing. And so any site that does perform that testing must be CLIA certified or Clinical Laboratory Improvement Amendment certified. And then KDHE has also opened their new reporting portal, and this has been open for a while, so most of you are probably aware of it. But just as a reminder, anyone who is doing their own testing on site, so that again is the people not sending them out to a private lab, but if you're doing your testing on site, you must report those through this reporting portal at the link provided on the slide. And if you're CMS funded and the test is positive, and those are going to be the antigen tests, those BINEX rapid tests or antigen tests. If it is positive, then the individual must be tested via an NP swab within 48 hours, and that's going to be a PCR test. For KDADS nursing facilities and their COVID-19 testing services, KDADS guidance was issued on October 27th and does require nursing facilities to begin using the 2-week county positivity rate published by KDHE at that link provided on the slide, and that's the graphic that we showed a few slides ago. That's what you're going to be looking for, and it's going to be under the nursing home metrics when you go to that web page. That's where you'll find all of that information. And then we provided 2 links for some resources, KDAD's long-term care testing strategy, and also KDAD's long-term care's COVID-19 testing status report. And then that testing status report is published and updated weekly at the link provided. So if you want more information, you can go and check out those reports as well. And then we provide a whole bunch of other resources that I'm not going to talk through all of them, but just know that there are CDC has done some testing guidance updates. Several of them are updated from January 7th, a couple from November, or 1 from November. So definitely check those out. That's guidance for testing in nursing homes, FAQs, considerations if you're using the antigen testing in nursing homes, and then also managing testing and management considerations for nursing home residents who have acute respiratory symptoms. So when we look at the health department's nasopharyngeal specimen testing for adult care homes, adult care home staff can be tested through the health department at the K-State Research and Extension Center, which is located basically at 21st and Ridge, and that is open from 8:30 to 11:30 a.m. and 12:30 to 4:30 p.m. every Monday through Friday. Appointments are no longer needed. It's just a walk-in clinic that's kind of first come, first serve. And this has test results can take 4 to 6 business days. They are getting back mostly. Most people are seeing them in 24 to 48 hours. But there are some occasional glitches with the system, so it could be a little bit longer. But most people are getting their results back in about 1 to 2 days. If a staff or resident does test positive, then we're going to recommend that other staff and residents in the facility be tested per either Sedgwick County Health Department or KDHE recommendations, depending on the situation in the facility. And then we've also updated our procedure for testing of COVID-19 testing at long-term care facilities and for employees, and you can view that at the link provided. And then just to reiterate that our testing at the Extension Center is all residents. It's not just nursing home staff, but it's any resident of Sedgwick County with or without symptoms can be tested. Staff can be tested on a weekly basis. Residents in general can be tested once or if they have a new exposure. But again, that is first come, first serve, no appointments needed. So when we look at CMS reporting requirements for nursing homes, all COVID-19 testing results are, again, required to be reported, and all point of care and send out specimens, that's both the ones you're doing on site and the ones you're sending out to the lab, are required to be reported. However, you are only responsible for the point of care. If you're using a commercial lab, that commercial lab is required and most likely is reporting those to KDHE. So the ones you're doing on site are the ones you must report. And then KDHE does send those reports to CMS on behalf of the nursing homes. And so we, as a local health department, will be able to access those results as well. If you have any questions about what to report, when to report, how to report, you can email KDHE at their KDHE EPI hotline email address provided. So I'm going to give a little bit of an update now about the COVID-19 vaccine. So the deadline for the COVID-19 vaccine pharmacy partnership has passed. So if you are a facility that was enrolled in that pharmacy partnership program, then you'll be dealing directly with either CVS or Walgreens regarding getting vaccinations for your facility. If you have questions about that partnership, then you may email the CEC at the email address provided. If you are not enrolled in the COVID-19 vaccine pharmacy partnership, then you'll have to coordinate with getting the vaccine from the health department. Staff right now can make an appointment via the Sedgwick County Health Department vaccine schedule for vaccinating at future clinic locations if they haven't already received it, and that link is provided for where they can go to make that appointment. Facilities that are wanting to serve as vaccine providers may apply through KDHE's COVID-19 vaccine provider enrollment at the link provided. So if you want to give vaccines at your facility, you can enroll with KDHE to be able to do so. And anyone with questions about that should call KDHE at either the phone number provided, or you can send them an email at the email address that's provided. More information about that provider enrollment can be found from the Kansas COVID-19 vaccination plan, and that would be section 5 or pages 20 and 21. And that link is also provided on the slide.
I forgot the Zoom document, the FAQ.
Okay. And then we also have the...
There's an FAQ.
There's an FAQ document. So if you, Susan forgot to download it put it onto Zoom, but if you would like that document, you can email Susan Lee at sedgwick.gov to get that vaccine provider enrollment FAQ. It's not available right now on KDHE's website. And then we've got some additional resources for you as well. So there are some CDC COVID-19 vaccine FAQs. And so if you are getting questions, they've got those provided for long-term care facility staff, ones for residents and their loved ones. vaccination in long-term care facilities, and then also just some additional resources for administrators and clinical leadership. So we definitely encourage you to look at those documents as well. And there is a little bit of newly released guidance from CDC, and so that we also encourage you to look at is some importance of COVID-19 vaccinations for residents of long-term care facilities, a toolkit to prepare for vaccination in your facility, as well as preparing your staff for COVID-19 vaccinations. And again, that's for the administrators and clinical leadership. And now I'm going to turn it over to Cody for requesting and ordering PPE and an N95 respirator decontamination process update. Cody, you're really garbled. And now it's just our end, but yeah, we can't understand you.
Reconnecting here. Any better yet?
Yeah, that sounds much better. Thank you.
Sorry about that. I have ongoing problems with this new camera. I have to unplug it and replug it every so often. So if we can move on to the next slide, you'll see the old information that I was mentioning. In fact, let me start over, because what I said that you didn't hear was I've got a mix of some old information and some brand new information to share with everybody today. And we're starting with the old information. This has been in place since September, I think, that the stopgap program that was put in place by the state of Kansas and the Emergency Management Division for them is still in effect, and licensed daycare providers, not daycare, you know what I mean, licensed care homes through KDADS are still expected to order their supplies through their normal vendors, first of all. If they can't get them through the normal vendors, then they can order them through the KDADS KDM stopgap program. And you see the facilities that are eligible for that listed on the slide there. If we look at the next slide, we'll see that the requirements is that, as I mentioned, you must try and order through your vendor first. And if you can't get it through them, follow the link that's on the page there. Just understand that KDADS and KDM will require proof of denial, if you will, that you tried to order the goods that we're talking about, but they were back ordered, that you were told, you know, you're not one of our normal customers, we can't provide you at this time, whatever the reason might be. Just have some documentation ready that will prove to them that you tried but were unsuccessful. As we see on the next slide, the things that you can order through the PPE stopgap program are the standard things that everybody's trying to order these days: masks and face shields, gowns and coveralls, and other things, gloves, disinfectant, all kinds of things are available through that stopgap program. We do want to talk about an important exception to that, and this is, again, part of the old news, that if you have an immediate need for life safety purposes, you've had an outbreak and you don't have enough PPE to cover everybody in the facility, then you can still order those items through us at Sedgwick County Emergency Management. However, and now we get into the brand new stuff, there's no longer a spreadsheet, a resource request form on our website. So what you're going to do is you're going to send an email to logistics@sedgwick.gov. And when you send that email, give us, you know, all the information about your facility, all your contact information, but you're going to tell us what you need, including sizes if that's applicable, and an explanation of the urgent circumstances as well. If you don't know exactly what we have and exactly what you're ordering, just give us generalities, give us as precise as you can, and our logistics team will get back with you through the contact information you provide and hammer out, you know, exactly what we're able to supply for you. We will fill whatever we can out of our supplies on hand currently in Sedgwick County in our warehouse, and then whatever we don't have locally, we will get for you through the KDM warehouse in Topeka. You used to, as I said, find that information on our website, but we have switched over to a brand new online ordering portal. It's a shopping cart like what you're used to seeing when you do any other type of online shopping. And that's what's now on our website. And you see the link that's there. That's to request your login information. Once you get that login account, There's a submit button on the bottom. It will generate an email to our folks here in the logistics team. They will get you your login account set up and email that back to you. And then you go to our Sedgwick County website, and the portal is there. That is in place now for first responders and government agencies. It's been active for about a week or so, maybe a little bit longer than that, actually. Since the very end of 2020, we had that up and running. And all the feedback that we've gotten on it so far has been very positive. So unfortunately, we can't set you up if you're a private entity. We're going to continue to do that through the email. But if you're a government agency or a first responder, make sure you get a login account to our new Fishbowl and LilyPad software ordering system, and we'll get you hooked up. I know some of this information may have been confusing. If you have questions about the stopgap program, you need to direct those to KDM, and there's an email that's at the end of the stopgap application. If you have questions for us here in Sedgwick County, then logistics@sedgwick.gov is the best way to get them. Moving on to the N95, and there's a little bit of new information here as well. The Battelle decontamination program has been extended by the federal government through March 31st of this year at least. So if you haven't already signed up for Battelle to decontaminate your N95s, please do. If you have signed up, you will continue to operate just as you have for the last 8-9 months, however long it's been in place, and get those masks clean through the Battelle process. FEMA is the one that set up this program, and of course it was put in place to help extend the life of the N95s, especially when they were so short-handed and in such short supply. Remember, if you are going to use the N95 program, the mask must be free of soiling. Things like bodily fluids, makeup, blood, all that. If they come in with that on the mask, they will be rejected. They will not be decontaminated, and you won't get it back either. So just keep that in mind. About the only ones that we can really have any direct control over is the makeup. And so, as always, we've suggested that you might want to consider a policy that you put in place just for N95 use that might prohibit makeup, so you don't run the risk of contaminating those masks accidentally. So that's all we've got for now, and I'll stick around. Oh, I see a question in the chat from Michael. Do licensed nursing homes in Sedgwick County still need to complete a weekly burn rate report and submit it? Yes, please. That's how we get supplies allocated to us by first KDM, and through KDM, that's how they get their supplies allocated to them from FEMA. So yes, if you wouldn't mind, we know it can be a little bit of a pain sometimes, but it is very helpful to everybody. The more of those burn rates that we get filled out and turned in. And that's all I've got for my share, but I will stay on the line in case there's any questions before we sign off.
Thank you, Cody.
Thank you. So now I'm going to talk a little bit about the emergency public health order. So the emergency public health order is from the local health officer, or in our case, Dr. Min. He did sign a new order that did become effective January 10th and is effective through February 6th. This order really didn't change much or anything at all. It's basically just an extension of the order that was signed back in, I believe, either November or December. But just as a reminder, residents are still required to wear face coverings or masks in public spaces, inside and outside. And then the definition of a mask or other face covering does not include a covering that is equipped with a one-way valve or vent through which air can be exhaled. And there are, as always, some exemptions for wearing masks included in the order. The order still also allows a group of 25 or fewer individuals, and the individuals should generally maintain a 6-foot distance from one another. And they are still, again, required to wear a mask within public gatherings, whether those are inside or outside. The complete order and FAQs can be read at the Sedgwick County website, which is linked below. And we still remain in phase 2. I don't know that we will ever get out of phase 2. We're in phase 2 still. We are looking at, as of yesterday, so as of technically last Friday, Saturday, Our fresh metrics show us at 13.4% positive, and that is stable from the weeks prior. Our metrics, again, are updated weekly at the website shown below. And then you also, just some notes, the metrics for KDHE are the ones in blue. We do have some changes to the metrics because the numbers are still coming in by test date, and so most changes will happen in the past 2 weeks, but they will adapt. The ones that are updated on Fridays are going to be the most stable, and then after 2 weeks, they'll be fairly stable from then on. And then for deaths, we do report based on the date the patient died. So even if the date of death is reported to us today, if they died back in December, that's where that death will go on the metrics chart. And now I'm going to turn it over to Annette Graham for updates on visitation.
Hey, thank you, Kaylee. Okay, so not much has changed at all, really, on the visitation. Next slide, please. So KDADS did provide information and instructed facilities to use the school gating metrics on 9/23/20. They have amended those instructions to ensure that facilities use the 2-week county positivity rate that is published by KDHE rather than the county level positivity rate. So here is the link to get that positivity rate. And they advises the adult care home to use these rates when making reopening and visitation plans, because it is based on that positivity rate by KDHE at the state level. Next slide. So the guidance for long-term care settings includes nursing facilities, assisted livings, board care homes, Homes Plus, and residential health care facilities that are licensed by KDADS. The types of visitations discussed are the compassionate care, indoor visitation, outdoor visitation, and window visitation. And there are some guidelines here at the link from KDADS. Next slide. So they did also publish last fall this nursing facility visitation guidelines. It's what to expect about visitation. So it really is a document that helps, that you can provide to family members or guide them to this on what to expect in visitation. And it is according to the facility's environment and residents' needs. So it's a person-centered visitation process and following strict protocols on reducing risk and preventing spread of COVID. So whenever facilities are allowed to have indoor visitation or more relaxed visitations and they will be continued to require the following of those kind of protocols, which includes the mask, the social distancing, and those kind of things, and hand washing. Okay, next slide. So the visitation, as I referenced, incorporates a very person-centered approach and it adheres to the core principles of COVID-19 infection prevention, as previously mentioned. Of course, the outdoor and window visitation pose lower risk of transmission due to increased space and airflow. Of course, those types of visitation are impacted by the weather and those kind of conditions that would result in some of that not being possible. Indoor would occur in facilities with low to medium county positivity rates and includes visits beyond compassionate care. Again, that's related to the positivity rate as indicated on KDHE's website. And our community, our county is not at those positivity rates low enough to allow for in-person indoor visits, except for compassionate care. Next slide. So the outdoor visitations allowed with all precautions, even during high positivity rates. We still would require that all visitors be screened for symptoms of COVID-19 with the questionnaires asked. Residents and visitors must wear a face cloth covering or face mask for the duration of the visit. Would be still required the social distancing and perform the hand hygiene using alcohol-based hand rubs upon entry. Next slide. For outdoor window visits, they are to be conducted in a manner to reduce COVID-19 transmission and increase prevention measures and must provide sufficient space when doing those types of visitations. Next slide. So for indoor compassionate care visits, these are allowed during any phase of facility to determine when compassionate care visits are to be appropriate, which it includes but is not limited. That the resident is in hospice care, the resident's illness, disease is worsening or life-threatening, the resident is exhibiting significant decline physically or emotionally, the resident was withdrawing, no longer eating, showing signs of significant depression as a result of loss of contact with family members. So these are all just examples, but they're not limited to this. So please be generous in your interpretation of compassionate care visit. There are other situations when it's quite appropriate, and as each facility determined when these are allowed. These are in-person visits that are allowed. Facilities need to provide for those and to monitor those and to ensure certain, COVID prevention are in place. Those hand washing, social distancing can be reduced in certain situations based on the situation and in the interpretation of each facility, depending on the situation, each specific. Again, it's person-centered. Next slide. So as mentioned previously per CMS, when county positivity rates exceeds 10%, indoor visitations are not allowed except for the compassionate care. And we are above 10% in Sedgwick County. So that does put this requirement in place. Next slide. Also important that when you have visitors, that visitors with subsequent illness within 7 days of the visit should be informed that they need to report their illness to the nursing facility and or the adult care home and to the Sedgwick County Health Department for need to track that. Next slide. So there are visitation guidelines resources. There's CMS guidance, and here is the link for that. And that was issued on September 17th. Last year, and then KDADS subsequently put in place guidance for long-term care settings that would include assisted livings, board care homes, homes plus, nursing facilities, and residential healthcare facilities. Here is the link for that, and that kind of mirrored the CMS guidance that was for the nursing facilities covered by CMS requirements, but it also gives a little bit more detailed. So those are the links for those two documents. The current CDC Visitation Guidance applies to long-term care facilities. Visitations may continue in consultation with local public health as per CDC guidance. And that applies even if a facility, staff and residents is fully vaccinated, as vaccines are not 100% effective. So that's kind of some new information that will continue to cover the visitation issues with nursing facilities and adult care homes. Next.
Are there any chat messages? Okay. We have reached the point in our presentation where we're going on just to give you some more resources, and then we'll move on to Q&A. These are some updates, news since our last webinar in December that we were finding on the KDHE website and also the CDC website for your reference. And these are our standing resources just that are appearing on our webinar slides for your reference. And this is a link where you can view all of the past webinar recordings as well as access the corresponding PowerPoint slides for the webinars. And my contact information is there for you. If you have any comments or questions, please follow up with me and we'll get a response back to you. And I will email everyone that FAQ that I forgot to upload to Zoom so that you'll have the FAQ in regards to the provider enrollment program. And then we'll open up to question and answer. Anyone having any questions or comments, we invite you to enter them into the chat box. And as I mentioned earlier, our next webinar is scheduled for February 16th, and the same time, 11 o'clock to noon. We do have a question. Haley?
So the question is, how do assisted living and Home Plus get their staff and residents through vaccination clinics? Walgreens and CVS are doing skilled nursing facilities. What about the rest of us? So your staff, per my understanding, your staff should qualify right now to be able to get vaccinated through the health department. They can sign up for appointments on the health department's website for those appointments. As far as your residents, I know we are following, at the health department level, are following the KDADS tiered plan. And I do believe assisted living and those fall into, if I remember correctly, I believe it's phase 2. And so at that time, they would be able to start coordinating either through us or through CVS, Walgreens in some way to get those facilities vaccinated. But I can have Susan, we can double check on that and answer that for sure in the chat, but I believe those fall into phase 2. So resident families are pushing, since we are still licensed long-term care, shouldn't we be in this phase? Unfortunately, we didn't set those phases. Those were set by the governor and through CDC and the guidance. And so that was not kind of out of our hands. So it would kind of depend on your type of facility as to where you would fall in those phases. But yeah, the health department did not set those. Those were set by KDADS in conjunction with guidance from CDC. Will we automatically be contacted, or how do we get on the list? I would say watch for updates to the Sedgwick County Health Department's either our vaccine website or our social media when we do move in from phase 1 into phase 2. At this point in time, we do not have any lists for that information. If we do come up with a list, then we would put that information out as to how you can register to be on a list.
Back it up to that.
Yeah.
Yeah.
So just to clarify, no facility should be conducting in-person visitation as long as positivity level is at 10% or above. Annette, I'll let you take that one.
Yes, that is true, unless only the compassionate care visits are the only ones that are allowed for in-person, as long as the county positivity rate is above 10%.
Where do adults with IDD fall in the phases when they reside in our residential programs? I believe they would also fall into phase 2 under that congregate housing. Do we have any other questions? Another one, this is for Annette again. No porch visits, only window and compassionate care, correct?
Yes, that is correct. Window visits and window visits and compassionate care.
Are there any further questions?
I'm sorry, this is Annette. Let me readdress that question. I just, after I answered that, thought, oh, maybe I am wrong. there is outdoor visitation allowed even during high county positivity rates, as long as they follow all of the requirements, which includes the screening, the following all of the guidance for masking, social distancing, and hand hygiene. So as you know, you have to just be cognizant of the weather and ensuring that the safety of the residents. And so inclement weather would maybe be counterindicative of that, but yes, according to CMS and KDADS guidance, you can do the outdoor visitation even during times of high positivity rates. It is only the indoor visitations that is constrained with high positivity rates. So I apologize, I gave you the wrong answer, but yes, you may do outdoor visitation, porch visitation, as long as you're following all of the required protocol.
If we have any more questions, we'll be here for a few minutes longer. If you think of something after the webinar, please email your questions to me and we'll get a response back to you. We thank you very much for your time and joining us today for the webinar. And we appreciate all of your questions and look forward to getting information on the website so that anyone who is not here can review it. You could go back and look it over, review the slides with all of the various links in there to the websites, especially the one for the vaccine scheduling portal on the Sedgwick County website, and check that frequently for updates because it's updated most every day. It seems there's just a lot of changes coming with that right now as one way to get your information and questions answered. And please follow up with me if you have any other questions regarding that.
Susan, there was a question that popped up in the chat about the slides will be sent out, correct?
Yes, the slides will be sent out usually as soon as the recording is live on the Sedgwick County website. I send out the link to that recording as well as the slides, and the slides will be posted also on the website with that recording. So they will definitely be sent out. Thank you for that question. Well, it's almost lunchtime, and I don't want to keep everybody here any longer than necessary, so we'll be happy to sign off and let you all go and enjoy your lunch. And again, thank you so much for participating. And we'll see you next month, February 16th. Thank you very much. Have a great day. Be safe. Thank you, Joey.